Hey everyone, this is Victor from Cyborg for Life, and I want to welcome you guys to episode 154 of Limb Lengthening Live, where the patients interview the guests. And today we are going to do a little bit different. Well, kind of. We're going to start off with a topic of discussion, and then obviously we'll do our open mic panel Q&A, and then we'll do a live Q&A at the end if you guys in the chat have any questions. But so real quick, the topic of discussion today is HeightMaxxing through limb lengthening. So I'm not sure if you guys know what HeightMaxxing is. I just found out like last year or the year before, but it's like doing everything and anything under the sun to get taller, right? Like spinal lengthening, decompressions, breaking, microfracturing your bones and craziness, things you shouldn't do. But HeightMaxxing through limb lengthening, it can work. You can do it through safe measures. You can do limb lengthening surgery on your femurs or your tibias or both. But what about doing it a third time, like going back after you've done quadrilateral lengthening? Well, that's the topic of discussion today, because a patient who was on last week, Ali, he actually found some patient is going to go back for a third round. Now, not, the re-break method, because we've had above tempo in the stream before. He's done that. This is like doing your femurs, the full 8 centimeters, I think, the tibias, the full 5, and then going back for your femurs for another, I think he said 8 centimeters. So that's going to be crazy. We're going to talk about that. Ali should be joining the stream soon, but real quick, we have Natalie on the show. She is a cosmetic bilateral femur lengthening patient. She has done 78, 79 millimeters on her femurs. So that's about the full 8 centimeters. So she's gotten 3 inches. She went from about 4'10" to about 5'1". It's an incredible journey. However, she's still waiting for her bones to heal so she can get back to walking. I'm going to bring on her x-rays that she just brought onto the stream to share, so we can look at them and get you guys' take. So let's go ahead and take a look at those real quick, and then we'll hop into the topic of discussion. So, Natalie, you brought these on. So, these are your latest x-rays, right? When were these taken?
Last week.
Last week? What day?
April 18th.
Okay, so literally a week ago. Okay, gotcha. So, based on again, I have been following Natalie's journey. She's been talking to me regularly, and based on her past x-rays, these have shown great improvement. She's been more mobile, doing more exercise, minding her nutrition, supplements, and all that stuff. So there's definitely more regenerate. It's clear as day. She's probably, I would say, not that far out from walking. I know that, she has heard different from, her surgeons, but what do you guys think? Anybody in the chat who has had femur lengthening surgery that's watching this, what do you guys think? How does this compare to your x-rays at this point? She's about 2.5 months after lengthening, full 8 centimeters about. So we're throwing it out to you guys. I don't know if anybody's in the chat.
I think it's important to, or it might be useful for people who are interested in this situation. I have quite slow bone growth. And, so April 18th, this was taken. 2 weeks before this x-ray, I had another x-ray, and you can really see, as Victor was saying, improvement. And I really think that improvement is I've been doing everything right. My protein has been great, 150 grams of protein. I've been taking, all the supplements that Victor and I talk about, collagen, vitamin C, multivitamins, calcium. I've got a bone stimulator, Exogen, I do twice a day. And really, I think it's so not funny, but it's interesting that what really helped was, instead of hopping on the walker, I'm just walking using the walker, like regular walking with the walker. And that's made, out of everything, that's made the difference.
Yeah. And Natalie, as you can see, DJ Cyborg, he also got femur lengthening done. He did about almost 6 centimeters on his, and he's saying that it looks about 6 to 8 weeks out from full weight bearing, with a question mark. So that's what he's saying. That's what the surgeons are saying. That's what the surgeons are saying. Yeah. So yeah, but again, I think it's based on the past x-rays that you took. Was it a couple weeks ago?
Yes.
Okay.
Yes.
I just have seen a tremendous improvement. Again, you've been sending your x-rays to me regularly. So it could be 6 to 8 weeks. It could be. I think it's going to be a little bit sooner than that. I'm calling about a month, and you're going to put feet on the ground. But we'll see. Anybody else in the stream here? We got, Ale was just, or Ali was just on here. But anyway.
I would love to talk to him.
I know. I think he's going to try to rejoin. But we'll hang here for a minute.
I can send the x-ray to you from
last time?
Yeah. Do you want me to?
Yeah. Send that. Anybody in the chat? So today, I know that everybody joined because they want to see who's this HeightMaxxing person. But once Ali joins, he's going to provide the information on that story of which patient's going back for third round to get his femurs lengthened. I think it's going to be kind of crazy. Is it safe? Like, you know, to go back and get femurs lengthened another 8 centimeters. Now, you guys know that I've interviewed a lot of surgeons over the years, Dr. Paley, one of them, and he said that the bone is not the problem. You can lengthen that forever, 20, 30 feet, but it's a soft tissue, right? That's the culprit of resistance. Will that be the hindrance that's going to prevent this patient from getting what he wants? So we'll
okay, well, I sent you the other x-ray.
Did you send it? Okay, let me see here. Okay.
So if it was, you know, DJ Cyborg, if it was 6 to 8 more weeks, that, you know, that will be potentially 4 to 4.5 months of consolidation for me.
Of just consolidation?
Yeah, I mean, which breaks my heart, but you know, it is what it is.
Yeah.
Yeah.
I
think
we all hope it'll be sooner.
I know. I think once you get to the 6-month mark, you know, from surgery, I think it's really starting to bug me that I can't walk, you know. I've been doing PT every day, and I've been getting better at bending down, which is another thing that you don't really think about, you know.
Right.
Yeah, but you know, it's something to consider. You know, Dr. Paley told me there is a 5%, you know, 95% of people heal within, you know, consolidate within 3 months. There's a 5% of people who don't, and I'm falling under that 5%.
Yeah, it's crazy. Because that's why when you first asked me, it's like that's why I called Easter, because based on when you had your surgery, I said that the average is right around 6 months, which would be here. But it's a little bit longer than that. Okay.
I filed my x-rays for next Thursday just so we could see on the live that day.
Okay, so here's Ali. He just joined. So let me go ahead and bring up your x-rays. So Ali, welcome.
Yeah. Hey,
how are you? So we have Natalie
on
the show, and these are her x-rays. These are the ones that she took the month before, right, Natalie?
Is that the new one you just brought up?
Yeah.
Yep. That was April 2nd.
Okay, so this is April 2nd, and let me bring up April 18th. Hold on, I gotta just I think they're not in a group here. It's kind of weird. Let me just share that. Darn it. Okay, so Ali, what do you think about these x-rays real quick? Because you had femur lengthening as well, and you did about 8 centimeters.
1 second.
I just want to put out a disclaimer real quick that none of us are surgeons or doctors. We're just patients, you know, analyzing another patient's x-rays. So it's just for fun and game. No, just talk to your doctor if you have real medical concerns. There you go. Go ahead.
So this is Natalie, right?
Yeah, this is Natalie, the one who's on the stream. Yep.
Is it like a fresh one, or
this is one from a month ago, about like 3 weeks ago?
So I don't know, man. Like when I looked at them, they look like mine, you know. Like, but as I said, I'm not a surgeon. I think maybe mine was still better because then I was allowed to be like walk without crutches. But when I looked for the first time, I remember that stream. Everyone was showing their x-rays like a month ago or something. That was the stream. And she showed her x-rays. I thought like mine looked kind of the same, you know, and I was also a little bit upset because I couldn't walk. And then in 3 weeks, Dr. G told me that I can walk, and I was like, oh, great, you know. So I don't know, maybe I increased protein and calcium, or maybe I was just wrong about my x-rays.
Gotcha. Okay, so we have some more guests on the show. Hold on, let me just share my screen. These buttons are getting funny on me. I'm trying to get all her x-rays in one shot here. Let's do this one. Okay, so this is her most recent x-ray. Let me bring on some other guests. We have Socrates, who is also a femur lengthening patient, and we have Master Distractor, who is also a femur lengthening patient. So we have like everybody on the stream, except for me, is a femur lengthening patient. So Socrates the Wise is here. We have to talk to him. So Socrates, what do you think about these x-rays? Where is Natalie standing? As you can see,
looking good.
Looking pretty good, right?
Lengthening is over? Or she still
Lengthening's
having
over.
lengthening?
These were taken last week, which was about the 5-month mark, give or take a week, and
Okay.
she's at 5.5 months post lengthening right now.
Okay. Doesn't look weight bearing yet, but definitely getting there. I would say eat more protein as usual, which is just a default thing, and use your rollator to walk as much as you can.
Okay. All right. Socrates the Wise has spoken. Now, this is her. I don't know if you guys can see it. Let me see if I can make it bigger here. Somebody. Let me see.
Got an echo.
Oh, yeah, there's an echo. Is that from me or is that Ollie? I see it. There it is. I muted it. Okay. Gotcha. All right. So this is her other lateral view. As you can see, the anterior portion looks good. Posterior lateral is kind of a little... Ollie, I think you have the YouTube on. Cancel the YouTube link because it's
really?
Yeah, it's echoing.
No, I don't, but I use AirPods, so maybe that is the problem.
Yeah, that might be the problem. Let me mute you until just so there's no echo. Okay. All right. So as you can see, her lateral view. This was again last week. Looking good up here. It's full bridging, but back here, it's just, and I think that's what her surgeons are worried about. So, yeah, she's not full weight bearing yet. Obviously, she wants to be. Everybody wants to be like, let me start walking. But, yeah. So this is so far, all the patients have agreed, Natalie, that you are not weight bearing yet, but they think you're well on your way. Would you say, Socrates? Oh, I think he might have muted himself. Socrates. There you go. Oh, I don't know. Can people hear me? It's like really quiet.
Yeah, we can hear you.
I can hear you,
okay,
Victor, but I was on a call. What?
Oh, I'm sorry. Okay, I'm just playing.
These two look good.
Yeah, you look good. Okay, got it. And then who else do we have? Master Distractor.
Hello.
How are you? You had your surgery like 2 weeks ago?
Yeah, on April 8th, I started lengthening on Good Friday. So it was a Good Friday. I can get to take a shower and start lengthening. Should be 7 millimeters in, I believe, or would be 7 millimeters in by the end of the day. Yeah.
Very, very cool.
7.25 because they do a 2.25 in the surgery. So
are you doing the 1 millimeter per day?
Yes.
Okay, very cool. Awesome. Really cool. And Natalie, did you do the 1 millimeter per day? I can't remember.
1 millimeter per day was very difficult for me. So I did it for probably 2 of the 3 months. And then the 3rd month, it was wild.
Got it. Okay. All right. Well, we are all hoping that in the next, I'm gonna say, I hope in the next month that within three to 4 weeks, she's cleared. But the surgeons are saying 2 months, but let's try to beat that. So do everything you can, get on those feet, on the walker, and walk.
Natalie, you gotta take them telling you 2 months as a challenge to prove them wrong.
Exactly.
Okay? So when I finished lengthening, it was April 16th, and they said it might be the end of May before I can walk. I was walking on May 6th. Okay, so make it happen.
Okay.
Oh, we got my namesake on here, DJ Cyborg. Welcome, man.
Hello. Can you guys hear me?
Yeah, we can hear you loud and clear. How you been, brother?
Good. Yeah, I just wanted to hop on because, Natalie, it's actually not uncommon. You said it's like 4 months of consolidation will about before weight bearing. That's not really uncommon because JP, I believe, he took until month 9 after surgery to get to full weight bearing.
Wow.
And he got it done in Canada, right?
Yeah, he got it with Gdalovich.
Yeah, Dr. G. Okay. So that's something there that hopefully that makes you a little bit of consolation there, Natalie. You're not the only one. And he was I think JP was late 20s male. So as you can see, it's not age related. It's genetic a lot of time. It's just different factors. So, but I'm hoping a month. So I'm going to say 6.5 months should be weight bearing. We'll see. But awesome,
Victor,
guys. Yeah.
Real quick. I just messaged you on WhatsApp.
Okay.
A 30-second clip of me walking.
Okay.
2 weeks after round removal.
Okay.
It's also on the Discord if that's easier for you to get to.
I don't have Discord on this computer. This is my Mac. It's in the other room. But can you do it again, Socrates? I don't see your WhatsApp. Send me it through WhatsApp.
It's still sending.
Oh, okay. It just came through. Okay. I'll airdrop this to my computer and I'll pull it up. So let me do that real quick. Socrates, give Natalie some motivation while I do this.
So what are you doing, Natalie, day to day to get back to regular weight bearing? Are you doing
I'm doing
biking that?
I'm doing PT. I try to get 5,000 steps a day, which is actually quite a lot, like on the walker. I got forearm crutches, so I've been using that. I find it easier to get movement with the crutches. I'm doing daily PT, 40 minutes a day with my PT, who luckily has experience with patients. And so we do a lot of reformer work on the reformer, so pushing and, a lot of sit to stands, things like that.
Okay.
I'm eating about 150 grams of protein, which is like overkill. I'm 5'1".
That's a lot.
Yeah. So that's kind of the stuff I'm doing.
Okay. Are you getting any swimming in?
I'll be swimming. I'll be near a pool in about 10 days. So I'll be in the pool every day until I can walk.
Good. I spent a lot of time in the pool. It's a massive morale booster because you can walk, you can run, you can do whatever the flip you want in the water. It just makes you feel like you can take on the. So
okay,
that's awesome.
I plan to be in the pool every day the minute I get a pool there and
then when you walk up to it with crutches or whatnot, or with your walker, people go out of their way to get out of your way. It's fantastic.
Okay, lucky it's a private pool, but that'll be it'll be good.
That's awesome. All right, so Socrates brought on a video, a progress video here. So Socrates, tell us when this was taken before we play it.
So this was April 20th.
Okay.
So
Socrates, you should mention that this is this was like a week or two after nail removal as well, right?
Yeah. So nail removal was on April 2nd, and that video was on April 20th. So it's 2.5 weeks exactly after nail removal.
Got it. Let me okay. Hold on, I don't know why this distortion. Let me change it back to what it was doing before.
Can you feel a difference with the rods out?
The moment I woke up from anesthesia, I felt better.
Wow, that's a normal
hated having the rods in because they were tight.
Look how effortless it is. How did that feel?
It feels normal again because your bones have that natural bend in them, and they're not forced to be straight as an arrow. It's awesome. I thought there was going to be relief. I didn't realize there was going to be this much relief.
Right. No, that's incredible. I think that let me share this one. This one's better. So we can see it. It's like more straight. That is the ideal walk you want after limb lengthening, after femur lengthening for full 8 centimeters. That's crazy.
Yeah. So I'm
telling you,
3 times a week, working on that glute strength, working on the abductors, adductors, so I can get everything stabilized. A metric ton of single leg work because I got my marathon in September coming up.
Oh my gosh, that's motivation, man. Congrats, man. I'm telling you, when you get the nails removed, doesn't it just feel so much better?
You're just like, I'm normal again. Look at me. I'm not a cyborg anymore, but it's okay.
Right. All right, guys. So the topic of discussion that we're going to have today is Ali, which is here. So Ali, you can unmute yourself now.
Just call me Alex. Alex was weird for me.
Okay, well, you should put that on your name. It just makes me, as the host,
maybe I just put it to keep my privacy in the beginning, but maybe I'll just put Alex later.
It's all out in the open now.
Because you could just tell them look, it's a fake name. Nobody knows anyway. So
there's only one Alex in the world that won't be able to.
But look, that's actually the point of this. People who know me call me Alex, but those who don't know me, they don't have to know me. They can think I'm Ale,
there you go. That's perfect. All right. So you kind of inspired the topic of discussion for today. It was about, I termed it HeightMaxxing through limb lengthening. And you basically found an article or I think it was a diary on the limb lengthening forum, which they banned me from, which those goofballs, screw them.
Really?
Yeah. I don't know. They didn't really ban me, but they just took down all my posts and stuff like that. I don't know what it was that I did. Nothing wrong to them. But anyway, Ali, you found this post from a patient who wants to go back for a 3rd limb lengthening. Now can you just tell us in a summary, he had his femurs done, he had his tibias done, how much length on each, and now he wants to go back for more. Tell us about that. I'm gonna share my screen. Hold on, let me share my screen.
Do you see it?
Yeah, I do. I gotta just pull it up here on the forum. Hold on.
There's a guy on the chat saying that's him.
Okay, can you guys see this? Is it showing? Is it,
I see.
Yes.
I see it now.
Oh, you do see it? Okay.
I
All right. This is the link you sent me. Where is it, Ali?
Read the last post.
Last post? Okay. Okay, so here it is. April 22nd. After my
consideration, yeah.
Yeah, okay. I've decided to go, I will be going for another 8 centimeters of my femurs to reach a final height. So this is my evolution. So another 8 centimeters. So he's already done 8 centimeters in his femurs to reach a final height of 6'1", street height of 6'2". I'm currently on the wait list, waiting for the precise max weight bearing nail. Am I not already happy? He says, I'm very happy with my current height. The goals I saw after when I was 5'5" have been achieved. I no longer suffer from depression. Life has completely changed. I live a happy, healthy, normal life. So why do it? Basically the same reasons we all do it, to gain the benefits of being taller. Believe it or not, the benefits of getting taller, continue up to the 6'4". After that, there really isn't much more benefit for getting taller. Dating life, all things being equal, dating life has transformed from when I was 5'5" till now I'm 5'10". Every 3 inches that I grew, my dating pool increased dramatically. It's sad to say, but the world we live in, I know that another 3 inches will dramatically increase my dating pool. No question that an athletic 6'2" will attract a higher tier dating pool than equivalent at 5'10" athletic male. Is this reasonable or am I being greedy? Height greed is a thing. So he says, I'll say that there are 2 main things to consider here. Finances. Am I going into debt in order to do this? Proportions. Does my wingspan allow for it? I'm thankful that when I was 5'5", I was so driven that I started a successful business, of which to this day is still paying me. So I guess it's residual income, something passive. I have more than enough saved. I have a big investment portfolio, a bunch of real estate investments. Nice. More than enough cash to fund this in some. Proportions. My wingspan is 5'10". My legs currently make up 57% of my total height. He's analytical. I like it. My wingspan being 5'10" is the main reason I'm able to do this again. That's kind of a good point there, but let's talk about this. After much research, I've discovered that before limb lengthening, my ape index was +6, 5'10" reach with a 5'4.5" at 5'4.5", which made me look even shorter than I was. I had gorilla arms. Hey, there's nothing wrong with that. You can deadlift more. Which if I scroll back to the start of my diary, you will see the evidence. This evident in my video. So I guess he has some, we'll do that some other time. But basically all this information, he's talking about proportions here. We're not going to get into the
Look this picture.
Where is it? This?
Right there.
Okay. Here's a
Can you imagine say it's a porn picture or something?
Okay. Is
Here's
it
the real
showing?
question.
Oh, it's not showing.
Where did he do his surgery?
Pele.
Yeah, it said Pele.
He did Pele both times?
Yeah, it looks like, yeah.
Okay, I gotta share this other screen. Hold on 1 second. Let me just
picture is interesting. Yeah, his proportions.
Yeah, I gotta go. It's on this one. He has it on this site here. Can you see it?
Yeah.
Okay. So here is his picture. I'm sorry if I can't pull up the whole thing, but oh, there we go. Okay, so you can kind of see it there. Okay, so if you want to blow your screens up, you can probably see it looks very proportional because he did quadrilateral lengthening, meaning femurs and tibias. So 8 centimeters, 3 inches here. How much did he do on the tibias? Did it say?
What I remember, he did tibias like 7.4, I think. And
really?
Femurs, yeah, and femurs like 8.2 or something like that.
He went from 5.5 to 5.
With Dr. Paley?
He did 7.4 on the tibia?
That's what it says in his diary. I think. Like,
where's his diary? What? This guy? Who is this person? Like, what in the world?
He said he went from 5'4.5" to 5'10", so that's 5.5 inches.
Right.
So that's what, 14?
14. That's 8
right?
plus 6. So he did over 6 for sure. What'd you say, Natalie?
I was saying I know someone who did over 7, is still doing over 7 with on the tibias with the Paley Institute.
Yeah, I think I know who you're talking about. But, if you go slow enough and your tibia is not going to consolidate, you can get away with it. But, like, he did quads. Did he do it at the same time? I don't think so. He split them up, right?
No, 1 year difference.
Okay, that's doable.
Yeah.
Okay, but
I don't think he'd say he was doing it a third time. if he did quads and then it was coming back for femurs.
Yeah,
like,
that
so
was
psychologically.
Yeah, this is crazy. I mean, he looks good right now, like proportionally. I mean, if you look at the memory
But he's
guys,
saying his feet are 57% of his height.
Yeah, his legs,
and then if
his
he adds
legs.
3
Yeah,
more inches, that's gonna get up there.
It is gonna get up there, but
I think if he just doesn't tuck in his shirt, then he could probably get away with it in the future.
Right? Yeah, that's true. That is true. But he's right. His arm length is ridiculous. And
how much is he? Sorry.
Go ahead.
How much is he trying to do on femurs again?
8.
Okay, so that'll be 16 plus 7.
He has
to me, it's just crazy. To me, I don't have anything to
Can't see the
say.
scars. Yeah, right. DJ Cyborg. I think the funny thing is though, if you look at proportions, right, and you guys remember the arm to torso ratio, like I think his arm length, because if he said he's 5'10" now, his arm length, his wingspan is the same as his height. So you usually can get up to 4 inches more and not look weird, 3 to 4, right? So he's going to be riding that line, but will he even get that? We'll see. But let's talk now about, is this even like, is it possible? I don't know. I guess we'll find out. What do you guys think? Is it possible?
His interlimb ratio wouldn't be too off if he does it. Like his tibias look like if his femurs were longer, it would look better.
Yeah,
right?
well,
his proportions now look a little bit biased towards the femurs.
I agree. I think because you know why? Because he overshot proportionally from the tibia. Because I bet you he had like something close to like an average 0.8 before he started, and if he did anything over 5 on the tibia, the interlimb ratio is going to be skewed. Yeah, so I think you're right, Socrates. Now, I have some questions I would love to ask him.
Yeah,
like flexibility, strength. I don't know. I mean, Ali just found his article over here.
He says he's on the chat, but I don't know if I believe him. Is it a guy named SideQuest saying it's him? But who knows?
Is he? Is he in the chat in here?
Yeah, where is he?
I mean, he says the guy is.
Tell him to join.
SideQuest, you guys are talking about me.
SideQuest, join. Please join. Get on.
Join, man. I want to talk to you. Let's talk, man.
Let's break this down. Camera off. Put anonymous letter as your name. And let's
just put SideQuest as your name.
Yeah,
and
just so
off,
curious, man. Like you don't afraid to have some problems. Like it's huge, like 3 surgeries. I would like to hear like you.
I mean, what is
Dr. Robbins' perspective is?
Yeah. He's doing it with them, though, right?
He's going back with them. That's
so
what he says.
So if they think it's safe, I don't think they won't
like them, or is he planning on talking to them?
Here's what he's saying: visually normal, yes, you would still look balanced. Yeah. So this is his assessment based on now. Camera friendly, you look totally fine. So he's talking about like kind of now. Okay. A mobility and athletics video before I do round 3. Show you guys my full recovery. I like this. Okay, well, share it with me. I can share it to the world.
Can you do all the normal things? Can you step up? Can you do a box squat? Can you run? Can you do a donkey kick? Like these things are. Can you carry a child on your shoulders? One of the funnest things to do when you have little 5 and 6 year olds. If your leg too tight, it becomes an absolute nightmare. So
yeah.
These things matter on more than a couple inches of height.
Yeah, because if you wanted, okay, so Ali, you said earlier, or Alex, you said earlier. I kind of like Ali name.
Okay.
I kind of like it now. It kind of rolls off Ali. Everybody knows you as Ali.
You can call me, look. No. Okay, I'm gonna change my nickname, Mr. Ukraine. So you can call me Mr. Ukraine.
Oh,
that's perfect. All right, so basically, you said earlier, like. What are the risks of going back for another 3 inches on the femur? Because right, so let's talk about that, because Dr. Paley, even in one of the interviews, he talked about, is there a risk of arthritis long term after femur lengthening? Well, we know that after a safe femur lengthening and you recover full range of motion, he said no, from his years of, I think, almost 40 years he'd been in the game. But if you go back and do more, is there going to be extra tension, soft tissue tension on the joints, right? Like the hip and the knee. You got to think about those 2 joints because they're what, the femur is bound by. So I don't know. I mean, soft tissue, if you do it slow enough, I think the thing that doesn't stretch is the tendons, the IT band, the fascia. A lot of that stuff is not as, pliable as muscle. So I don't know. I mean, you're growing new muscle, you're growing new soft tissue. So is it possible distraction histogenesis? I think it is possible. Is it risky? I don't know anybody who's done this, so this will be new for me. What do you think, DJ Cyborg?
I mean, we do see people in, Turkey and stuff getting like 12 centimeters on the femur with like LON and stuff. And I mean, technically, I guess it's possible. I haven't heard of a 16 before, but I've heard of like, I think the highest I've heard of was like 12.8 or something. And that guy did like LON femurs and he had like really, really bad duck ass and stuff. And we never saw him update his stuff anymore after that. I mean, if you do it at what happens?
Yeah, I mean, but 3 inches. I mean, right? Like I could see. Like, don't get me wrong. I know there's patients who have achondroplasia, hypochondroplasia, with dwarfism, but their soft tissue is a little bit more pliable. It's different than adults. But then there's also people with idiopathic short stature who also get massive lengthenings, or patients with discrepancies that get massive lengthenings on one side, and sequential lengthenings, like broken up. Is it possible? I think we've all agreed that yes, it is possible. But what are the risks? I know for a fact that for my discrepancy lengthening of the tibia, my knee height is my hips are level, but my knee height is actually not. And I feel like that's actually causing wear and tear right now. I already just recently had like a knee sprain. I have torn meniscus, whatever. I think that joint stress is something that is worrisome. I don't know. What do you think, Natalie? Is she here? She left.
No, I'm here. Sorry, what was the question?
So what do you think about this guy going back for another 8 centimeters on his femur?
I don't know. I mean, like,
she's like, I just want to walk.
No, I mean, I look at my femurs, and everyone said to me I'm lucky because my tibias are a bit longer. But I look at my femurs now, and I think if I were to do more, it would look awkward. I would be able to tell. I know with clothes on, you wouldn't be able to. But I don't know, to each their own. I've been, you kind of suss out if you want to do it. It looks like to me, after, being near the tail end of this, potentially 2 months out, it's a long process. If you're okay, not walking for 7 to 8 months, then
no, he's waiting for precise max. So I think he doesn't.
Yeah, I mean, let's see what happens with that.
He's going to be waiting for 7 to 8 months plus.
Well, you never know, right? They kept saying the stride nail would come back. They kept saying it would come back, and then it never did. It never made it back to market. So you never know.
Yeah.
So
if I was, because the PMAX was supposed to come out like the month I had my surgery, if I had like committed to waiting for the PMAX, I'd still be waiting.
Yeah.
So
exactly.
And I had my rods removed this month. So just do it. I'm gonna do it.
Yeah. There's this website, guys, I want to just quickly mention. It's called boostmyheight.com. That's boostmyheight.com. And, for me, I know I'm not 5'4", which is the average height. I'm feeling pretty comfortable with 5'1" right now. But, you can go and look at top boosters on this website and look at, there's like this Adidas Prime X2. You can get an extra 2 inches on that shoe. So you can go on that website.
That's true.
Yeah, look at top boosters. So look here, and then you can click on the Converse Run Star Hike, and you can see that gives you 2 extra inches once you click in there.
Okay.
Yeah, and now scroll down. Okay.
Oh, right
here.
So
2 inches, right? So
5 centimeters.
You can sort by top boosters, or like for me, I love Hoka's, right? So you can go into height by brand, and then you can see which Hoka's give you the most height. Wow. So, that might be something if there's listeners that are uncomfortable with their current height and they're waiting to do surgery, that might be something to look at, 2 inches, is a lot. I know that now being 3 inches taller, but it's just a little hack here that you might want to take a look at.
Absolutely.
So you know what the difference is, Natalie? I wore elevator shoes, gave me 2 or 3 inches for like 5 years, and I afford them to work, to outings, whatever. The only time I wasn't wearing them was when I was running, because obviously, the difference now is I'm the same height, but it's natural, and I will ever wear platform shoes again, because it's just no comparison to having the height just be naturally part of your body.
Absolutely.
Versus the shoes, which is why people might say, "Oh, just." My doctor, my primary care physician, when I told him I'm doing the surgery, he was like, "Why don't you just do what did he call it? I want to say he called it something like Italian limb lengthening," and he was talking about elevator shoes, and I was like, "Dude, I've been doing that for 5 years. It doesn't help."
Yeah.
So,
And I've been doing that too for 15 years, and that came with its own, that came with its own set of problems.
Still there. I still have my elevator shoes. They're in the trunk of my car. I don't know the next time I'm gonna. I don't think I'll ever wear them, but they're there as like a, what is it called? War something, rather, just like a reminder of where I was and where I'm at now.
Like I had trouble taking them off ever. Now I'm stuck with them, right? And I can't do certain activities. So I mean, you can wear them, but I don't know.
Yeah.
I actually think that this site is pretty cool though, because it's like it also allows patients to kind of feel out their height that they're looking for before they do it. Up to 2 inches. That's pretty cool.
Well, yeah, and if you're not blessed enough to have the finances,
true. How much do these cost? Let's see.
Well, I was looking at, my buddy who did femurs. He got the Adidas X2s, and they don't even look chunky on him, and it gives him an extra 2 inches. So he went from 5'3" to 5'6" with the shoes. Now he's 5'8", right?
Wow.
So
that's pretty cool.
It is cool.
Yeah. All right. Well, that's a good little thing there. But let's so SideQuest is saying, going back to him, he says, "I've already fully recovered. I spoke to Paley, and he said that I'm basically a normal patient. I would only do it with Paley because he's the safest way, but I'm waiting for the Precise Max to do it." So I think waiting for the Precise Max is smart because, I think lengthening that bone a lot. I mean, now it gets to the point like, wow, 6 inches in one limb segment. And I know that you've seen some risky surgeries out. That's a lot. But like now I think that's beyond my comprehension of biomechanics. I just can't imagine like the leverages. And he works out. He's in the gym in that picture, right? So SideQuest, man, my hat is off to you for wanting to do this. But like at the same time, I'm like, what do you do for your workouts? Do you do like just, weekend warrior stuff? Are you a weightlifter? Are you a endurance athlete like Socrates? What do you do for your workouts? How active are you? Because I think that's where my question arises. We talked out, is it possible? Yes. What are the risks? We don't know, but Dr. Paley apparently says that he's a normal patient. I'm sure that he has some experience with it because he's been in the game a long time. I haven't seen any patient or that I know of that did this. And then what are the long-term ramifications, right? Like could something like joints stress, leverages, because I mean a longer bone, so I don't know. I'm kind of curious.
In a sense, it's kind of like a re-break with a nail swap.
Yes.
When you think about it, right? So we know that re-breaks work, right? Where you do the 4 and 4. Mm-hmm. But imagine if you had to swap your nails because it bent while you were consolidating for the first 4 or something like that.
Right.
And then you have a potential for another 8. That's a lot.
Yeah. I think proportionally, if we were to take all the aspects of, cosmetic limb lengthening here and factor them in, proportionally, he's going to look fine. I think DJ Cyborg was on the money.
I wish we had a before picture.
I do too. Because right now he looks like a normal person. He looks like he's freaking 5'10". He was born like that, right? Like he just grew to that.
If he just like doesn't tuck in his shirt, I feel like even if he did like another 6 in the femur, it'll still look kind of good just because of how long his arms is.
Right. Yeah. I think I agree with you there. I think
he
has. That's why, like for me, when I do this in the future, my wingspan helps me.
His knees would be fine.
Yeah. Long arm wingspan with a torso that's at least average and not a super short torso will help you. He actually has a really good proportions. Like this is coming from a guy who does symmetry for his sport. So all right. So that's really good. I think that was a great discussion about that. I'm wishing him luck. He wants to go back. He said money's not an issue. He's got the money, so can't foul him for that. I'm sure that time's not an issue because he already has his length, and went from 5'5" to 5'10", so he's getting all the benefits from that already. So he's chilling. He's back to working out. He's living his life to the fullest right now, and he just wants more, right? He wants to just kind of maximize his life, and that's why the whole topic of discussion is height maxing through limb lengthening. So I think this is interesting. You know, it's kind of exciting. But anyway,
Cyborg and we're talking about doing tibias down the road.
Okay.
Because it just gets to be where like you did femurs, you do more. Doing femurs then seems very challenging. But doing tibias is potentially reasonable, right? He's very comfortable and decided. I'm on the fence.
Really? When would you go for it if you did it?
After my marathon.
Okay, that's fair. That's why I'd wait till I win the world title before I consider this. And the Cyborg meal comes out.
There are other priorities in life, right?
I got other priorities. Right. All right, guys. So there's some questions in the chat here. So we're going to spend last 15 minutes or so trying to go through those, and we'll call it a day. But anyway, real quick, side quest. Wish you all the luck. Keep us posted. You are in the chat here, so you watch the show. You got to come on the panel sometime. If you just get a voice mod or something like that. If you can't do it, you know, it's good to have you part of the community. We wish you the best. You'll be one of the first that I know of, and I've been doing this for 5 years, that has gone back for
and side quest, if you're still on, like if you have Discord, or if you don't have Discord, like just create an anonymous Discord and join the Discord, because I'm sure a lot of people will be really, really interested in following along on this.
Absolutely. Shoot, that'd be crazy. All right, let's see. So some questions in here. So let me go ahead and stop sharing here. We got to go ahead and answer. Oh, what did I do? Oh, I didn't press it. There we go. Okay. Let's see. So people are asking a lot of questions. So Natalie from DJ Cyborg, he's asking, are those 10.7 nails that you have?
Yeah, it looks like Natalie bounced.
She bounced. She probably had to get. Yeah. Okay. Cool. All right. So here we go. This one, we'll go around the panel. Socrates, you're going to take this one. After the first or second surgery, the nerves stretch to the new shape, but after a few years, do they return to the same shape as before the surgery? So he's worried about like nerves being altered.
I think as long as you keep the nerves engaged, you're good, right?
Yeah.
The whole point of this is to grow, and you need to keep the blood flowing. You need to keep the muscles moving the whole time. So sedentary in this process is really, really going to set you back.
Yep. Agreed with that. Hey, Aiden, I remember you. Now we'll be walking in 4 weeks. Okay, very cool. All right, so Rebecca's saying, I'm a patient now recovering from femur length. Okay, we're just going through these. Sorry, I didn't really vet them. All right, so side quest. Hi, quick questions. I'm 5'10". So he's actually asking questions. This is what he asked earlier. Yeah. Oh, okay.
Yeah, that's the guy. That's the guy we're talking about.
That was at the top there. Very cool. Well, we know your answers now. We know who you are.
Funny is he's asking us when PMAX is coming out, and he's saying he talked to Bailey about the
series. Bailey would be the one to know.
You got this right there.
You got the direct source, and if you're going to pay him money, he'll make sure that you know. He'll be like, yeah, let's go. All right, let's see. Oh, you're from Ghana. Very cool. Let's see. Questions. Okay, here we go. Master Distractor. My height is 170 and the wingspan is 171. What's the most suitable overall leg lengthening in order to get not out of proportion?
Height is 170 and wingspan is. I mean, it's proportional. I think people blow proportions out of proportion, so I'm the wrong guy to ask. But I mean, most people get away with 8 centimeter femur lengthening. So I'm assuming that is that. But proportion-wise, I am horrible with that. As far as I know, for my proportions, my arms are too long and I need leg lengthening. So that's what I.
for the most part, I mean, everyone's opinion varies, but I think if you just keep it within 10 centimeters, you'll be fine. So if you have a wingspan of like 171, if you go up to 181 even, you'll look fine.
Yeah,
I agree. I think 10 centimeters is right on the money. I've actually analyzed enough proportions over the years that I find between 4 and 5 inches, usually for most patients, it looks fine. So yeah. This one's for Ali S. Sorry, I skipped you. Ginger Cat is asking, My surgery was November 7th, and my hip bone is still visibly swollen. Was wondering if any other femur lengthening patient had the same thing happen. Ali.
No, man. I told you before I didn't have any complications or pain, so I cannot answer this question, unfortunately. I think he needs to talk with his surgeon, because there is definitely something not right if he has swollen something and he did, well, like November 7th? It was like a half a year. So that's definitely not normal. So I cannot answer that, because I just think, yeah, what I can say, just talk with the surgeon. It's something kind of scary, I would say, if it's still swollen.
Yeah. Did any of you other guys, your other femur patients have that? Socrates or DJ Cyborg?
Yeah, I don't know what that is.
Around the stitches?
I think it might be one
How
of
does
the
a bone
proximal
swell?
screws.
That sounds very problematic.
What it might be is, maybe this is just me going on a limb. I don't know what device he had or whatnot, but I've heard of some mechanical nails, like some of the proximal screws can be protruding into soft tissue and causing inflammation, which can be causing swelling. So I don't know if that's the case here, but I have seen that in x-rays before, and surgeons have seen those in x-rays. I don't know enough information to answer, but okay.
You remember what Brian was saying like several weeks ago? If something, no, maybe it was on his 3 hours podcast. He was like, if something is itching, I'm afraid right away it might be infection. So I don't want to scare this guy, but if I would have something swollen after 6 months, my surgery, I would be like really afraid. I would just go to the surgeon, ask what is that, do x-rays, do some checkups.
Yeah, absolutely. Good advice. Boystorf saying, theoretical question here. This one's for DJ Cyborg. If you're under the weight limit for the precise nail, can you technically use crutches, or do you still need a walker for support?
I mean, this is something people ask me a lot, even if I suggest crutches. I know a lot of surgeons do, but for me, I know like I use both walker and crutches, and I just don't like crutches because it's too easy to have an accident with them. Like you can slip or fall if the ground is wet, whereas the walker is a lot more stable. And usually with the precise nail, you're not going to be under the weight limit, because even the 12, I think the weight limit on that's like 75 pounds. And if you're an adult weighing 75 pounds, like you have more issues than, trying to get more height.
That's very true. Yeah. I think that, if you know how to use the crutches properly, you can do them, but like the walker is a lot more stable. The rollator. Let's see here. Any other questions? Side quest is just talking to people in here.
For this, I mean, I'm doing it right now. Both, I think me and Ali up north here, we use both often, crutches and walker, because we need to we usually try to get our steps. But I mean, I think it depends on people's weight and a bunch of other things. But for me, like today I try to do 2,500 steps on crutches while I'm lengthening. So I think it depends though on patient to patient.
And you're also much lighter than some patients.
Yeah, that's true. Yeah. I think we're both in 40 pounds.
This one's Natalie saying, should people do quadrilateral? We don't know. Everybody's different. But this one is to the panel from Cyborg Gal. Wow, we got so many cyborgs here. DJ Cyborg, Cyborg himself, and Cyborg Gal. And Natalie's a new cyborg too. Panel, what do you think about a relationship if one person does not know the other one did this procedure? Socrates, you actually are dating a new girl, right? So you can answer this one perfectly. It's going back around to you. So let's go.
I would say really need to trust somebody before you tell them, and make sure that they're not gonna like hold it against you or misunderstand you. Obviously, if you're already in a relationship and you're deciding to do this, don't lie and don't hide it, because they're gonna know. But yeah, I wouldn't intend on telling people when you first start dating them. If after surgery, you can just move on with your life. It's sure an important part of your identity, but it doesn't need to be a primary part. So it really depends on the relationship and how comfortable and how trusting you are. Like, would you tell them your social security number? If the answer is yes, then you can tell them this. If the answer is no, then you should probably keep this to yourself.
I really like that answer actually, because it's like people do cosmetic procedures for anything and everything, right? Like, but they don't always go disclose that to their partner or whatever, right? So it's like you don't have to tell people, especially if you're recovered or you're walking, right? Like if you're in a wheelchair and they're like, "What happened to you?" Like, you know, it's up to you from that point. But I think like if you're healed, you don't have to say, "Oh, by the way, I had this procedure and I got 3 inches taller." Like, well, why say that? Just
Like I had
you're 3
a
inches
friend of
taller.
mine, and this is just a platonic friendship. She asked me, something came up in conversation today, and I was like, "Oh, I'll do that after physical therapy." And she was like, "Why are you in physical therapy?" And I said, "Oh, I had corrective surgery, and I just got the rods removed a couple weeks ago." And she was like, "Oh, okay."
See,
That's it. That's all she needs
that's
to know.
perfect,
Move on.
right? Yeah, it's like it's a one-liner, and you just brush it off, right? I think that's perfect.
Yep.
Honestly, a lot
There's
of people
no
make
lie. There's no nothing. If they dig in and they start prying, you can be like, "When did this become a confession?" Right?
I love it. I love it. All right. Shoes are not a long-term solution, but a good test. How much height you'll benefit from height. Yeah, they're talking about the shoe lifts
Well
earlier.
said.
So I have a limb length discrepancy on one limb. Is it wise to push for 6.5 centimeters on the short tibia and 6 centimeters on the normal tibia? So, yeah, wait a second. Oh, you mean like the overall height for the tibia?
I think, yeah, 6, assuming you're going to get 6 is aggressive.
Right. Assuming you're going to get 6, yeah.
Trying to resolve a half centimeter discrepancy with limb lengthening is, I literally did that. I did a whole centimeter discrepancy.
Did you really?
Yeah.
1 centimeter?
Yeah, I had my left was longer than my right. So it was a 1.2 centimeter discrepancy. So we ended up lengthening my right 8 centimeters and my left 7 centimeters. And now I have basically no discrepancy anymore.
That's
and
crazy.
It feels more natural. Like I feel like obviously the height itself is a big part of it. But even if you factor out the additional like joy and comfort in my own skin that I have from being taller, it just feels better. Like my hips are even now, which is great.
That's
awesome. Joaquin Califano, I think that's how you say it. I think he's a member of the Discord. I think he's going to Dr. Parhar actually.
Oh, cool.
And I don't.
If you're doing X
I don't know.
Then
maybe
then
ask.
6.5 is not all that aggressive.
Yeah, just ask your surgeon. Like if you have a 5 millimeter discrepancy, like is it smarter to push for 6.5 and 6, or maybe the surgeon would say like let's just aim for 6 and 5.5 first, and if you can get that extra, then we will. You know, maybe it's a situation like that.
Yeah.
So one is half a centimeter longer, and it ends up being half a centimeter shorter.
Exactly. Now I don't know though. Like the funny thing is with some surgeons, like I think Dr. Robinson, maybe Dr. Reefer, somebody says that like balancing a discrepancy, sometimes you want to shave it down by half because the body, it's too much adaptation for the body. For me, I got it smacked that. I was like, I want to be perfect. She was like, okay. I was like, make me perfect, but and you do the same thing, right?
Are precise. Right?
They're precise. Yeah, it was like fix this. But some surgeons, they'll take the it'll be to their discretion that they'll say, hey, let's just shave it down. We want to create a problem that we don't need to. So I don't know, but yeah, ask your surgeon. But lengthen and observe once you get to like 4 centimeters because things can happen pretty quickly with tibias. Natalie's back. Natalie, somebody asked you a question earlier. I forgot what it was about, but let me see if I can find it real quick. Oh yeah, here it is. Natalie, should I do quadrilateral? Should people do quadrilateral? All right. Oh, is she talking?
Natalie's trying to talk, but
yeah, Natalie, go off and come back on. I don't know if it synced with your connection device. I'm not sure what's going on. SideQuest is saying Billy is the GOAT. He says, I work out 5 times a week plus play sports 3 times a week. Was doing sparring, boxing for 2 to 3 years, but now I'm doing pickleball. No one knows. I'm pretty athletic. Okay. That sounds amazing for a quadrilateral lengthening patient. I'd love to see some recovery videos. Hey, Natalie, are you here?
That's wild.
Hey, can you hear me?
Yeah, we can hear you now.
Yes.
To answer the quad question, personally, if I was going to do it, I would do it all at once because I'm maybe I'm a bad person to ask because I'm like dying to walk. I'm at that dying to walk stage. I just personally wouldn't want to do 2 surgeries and not walk for over a year, in between those 2 surgeries if you were to not do quad.
Yeah, I agree. I think if you can get it done in one shot, the greatest. But if you think side quests, right? Like he maximized. I think it depends on the person's life, right? Like in their situation. But personally, one and done is kind of cool too. Or you can do it like DJ Cyborg and split it up. He's going back to Tib. All right, let's see this one. Cyborg, you got to do this in the future. You like the topic-based thing? Okay. So we may do something like that. All right. So there's a few more questions in here. Then we'll call it a wrap.
Victor, I think he meant you have to do the procedure in the future.
Oh,
there you go. Yep.
Okay. Yeah. No, I'm gonna. But look, they gotta have a cyborg nail or some sort of weight-bearing nail because, like I said, I think I was talking on a consultation the other day, and they were like, "Are you gonna do it?" And I'm like, "See, when I was 5'7" before I got my first one, because you're only as tall as your shortest leg, I had to get that done, not only for the discrepancy, the pain, and everything that was like wear and tearing, but it was almost, I wanted my height too. I wanted to reclaim my height of my taller leg. So I got that. So then now that I'm like just about 5'9", and with shoes clearly 5'9", height doesn't pop up in my mind. It is because I'm talking to all these people about height, right? But like out in my normal life, like when I'm out on dates and stuff like that, I don't have this issue about my height. So if I see a friend of mine at the gym, he's 6'4" and he calls me shorty. Okay, well, I flex a muscle and then it's all over. The conversation's, done. But I think that if you were to say like, do I need to get it done because I want to be taller because people are ridiculing me, making fun of my height or something? No, it would be physical for appearance and aesthetic reasons only. Proportionally, I could get up to 6 foot. I would probably go 6 centimeters on my femurs to get to 5'11" and call it a day. That would be perfect for me. So yeah, maybe I will. But like I said, they better brand this in the cyborg. They better make a cyborg nail or else it's not getting done. All right, let's see here. What do we have? So this one, Cyborg Gal. Wasn't Pilly saying he's talking. All right, let's see. Thanks for answering. Okay, my surgery. This is for you, DJ Cyborg. He's saying my surgery's in September. After knowing about cosmetic limb lengthening, I've lost my height dysphoria defenses now. Oh, how do I cope till the surgery date? So, DJ Cyborg, take that real quick.
Well, what does he mean by
he can't wait?
He can't wait.
Yeah. So basically, now that he has hope to get this done, he's saying that his height dysphoria is kind of like fading away, but now he's like, how do I think, is that what am I interpreting this?
He's feeling his height dysphoria a lot now because he knows get rid of it.
Oh yeah.
Maybe he was trying to cope with it before, but now it's coming up and he's like, fully like, but that's what happened to me too. Like, cause I had to like drop my heels kind of deal.
That would be my recommendation. Work overtime,
if it's in September, if it's in September, that's only like 4.5 months. I mean, you waited your whole life. It's only 4.5 months until the day. So just be excited for it.
Get in physical shape.
Yeah.
Stretch like there's no tomorrow. Eat better.
Yeah, run.
Goes by fast.
Yeah, stretch. Yeah, get ready for that surgery. Yeah, for sure. All right, this one for you, Ali. This one. I did my X-ray. The doctor said my femur and tibia bone canal is too small for the 10.7. Oh my gosh. Should I use this 8.5? I heard that the smaller nail.
I got this.
You have the same. You have the 8.5s?
No. I had this. I talked to someone and I got the same. I got the same diagnosis. The 10.7 is too small. So I talked to other surgeons, and right now I'm on 10.7. So.
Oh, okay.
So I mean, I think
with this, like I know some people who did get the 8.5, and usually this is like surgeon to surgeon. Some surgeons, they're not comfortable reaming too much because it can slow bone healing and stuff. But some, they'll be okay with just reaming a little bit more and getting the 10.7s in. Exactly. But, I mean, if you're over 130 pounds, like you really shouldn't be using the 8.5 because I know like 3 people who had a 8.5 bend.
Yeah.
There's one guy, Chart, I was pretty close to. He was a Dong-Hoon Lee patient. He got 8.5s and femurs, and they bent at, I think it was like 4 centimeters, and he had to get them replaced with 10.7s anyways.
Natalie actually sent me a link of Dong-Hoon Lee talking about his research about the 8.5s, and he said that it's the rate of bending in that specific diameter nail is significantly higher than the other ones. Remember that, Natalie?
Yeah, can I answer the question or?
Oh yeah, I gave the question to you. I'm sorry. Go ahead.
Because you asked me, but everyone else answered.
Yeah, it's a big panel. Go ahead.
So I would say like I'm kind of conservative with that. First of all, what I told you on the stream is like when you find the surgeon, you need to be confident with the surgeon. So do what your surgeon said. If your surgeon said do 8.5, 8.5, and just be careful, like when you walk and do anything, because you're not the one who will choose 8.5 or 10.7. It's the same when I asked Dr. G, I want to have 12. And she said, I will try. It was for the surgery, but I don't think it's going to happen, but I'll try my best. When I woke up, she said, you know what? Your bone, like canal, looks like small, but it fit. You got 12. What is that? 12.5 or something at the big one. And I was happy with that. But, if she would give me like a medium one, even small one, I have no choice because that's the surgeon I chose, and I'm confident what I chose. So this is the answer. I don't think patient can decide what nail. Like your surgeon will decide, and that's why you have to be confident and choose the right surgeon. That's very important.
Yeah, no, I think beautiful answer. I think you're right. A lot of times surgeons can't tell until day of surgery. They can tell up to 50%. Sometimes if you have somebody like super elite, like Paley, he can look at it and say, nah, we'll get it in there. But most surgeons, they have to wait till they get there into the surgery to tell for sure. But he's saying, I think, Ali, in fact, I think this is interpreted differently. He's saying, should I do it at all, or should I just use the 8.5? Or wait for the 10 precise max. There you go. That's a perfect, that's a good solution right there. No, yeah. So that's what I think he was basically saying. Dave Pan, you can tell us if my interpretation is correct, but
yeah, if he can take his like bone canal can take 10, I would wait. Yeah. No sense to rush. Just wait and get the bigger one. Yeah, because if people saying it can bend, no sense taking the small one. It might be worse. You break it, you do another surgery, you pay more money. It doesn't worth it. It's better to wait.
Yeah.
I would ask your surgeon if the 10 millimeter nail would fit, why won't the 10.7 fit? It's like a millimeter of reaming.
Yeah,
that could be a good question to ask your surgeon.
Right. No, that's for sure.
I feel like you should ask other surgeons too. Like,
yeah, you don't have to just pick one. There's many surgeons you can ask, get some second opinions.
Yeah.
Okay, so he had a second question here. Okay, so we'll go a little over, but that's okay. So I just want to answer these questions. I recently got a good job in earning money and saving. My parents are so happy, and they thought that I'm saving for a new house. How do I bring up with my parents that I'm not saving for the house? I'm saving to break my legs. That's going to be a question. A conversation. All right, man. Anybody have any solutions on that one? Natalie, I want to get your take on that. What was she? Oh, she left. She's like gone. Let's get the great Socrates. You can answer that one. He fell asleep. Okay, Master Distractor, go ahead.
Yeah, I mean, if you bring it up to the parents of what I did, I made a whole presentation of all your videos and documentaries. and showed it to my mom and my best friend, saying I really want to do this, and I think this is the best investment I can make for myself. So
awesome, that's cool.
So I think because most people won't listen to me, so I show other people's, how everything worked out for them. So it's not coming just from me, but other patients and people as well. So that was my solution.
Got it. All right. So the last 2 or 3 questions. Oh, so this was to go back to you, DJ Sab or Ali, saying that there's no pain. This is about the swelling on the side of the hip. There's no pain, and the X-rays look perfect. I've been walking with no problem. It's just that my hip socket looks much wider than before. I'll ask my doc next time I see him, Dr. Mabubian. Okay, yeah.
Yeah, I'm still afraid of stuff like that, because what I was like concerned is like I even asked Dr. G if there is a sign of I don't want to scare this guy, but I'm just saying if there is sign of infection, I mean, if you got it, you might not know. I don't know, like for a month, more, like half a year, less, depends on your immunity, your body. So if it's swollen, I would just check as fast as possible with my surgeon. What is that?
Yeah.
I say And this is something I'm not too familiar with. It's just that I've discussed it in DMs with a few people, and there's this thing going around, people saying there's a possibility that if you got pushed into like valgus slightly, or was it varus, like it might make your hips look a little wider or something like that.
Yep.
So maybe, yeah, just ask your surgeon to check with the alignment again, if the alignment's good, or if you've got pushed into valgus a little, because usually if you use a piriformis nail and you lengthen, like you will go into valgus a little bit compared to like a trochanteric nail.
Yeah, absolutely. And actually, I think that I've heard a surgeon that I've interviewed before. It says that I think it was Dr. G actually says that you're right. It does push your hips a little bit wider, but it does depend on the nail and the entry point as well. So surgeon will know for sure. Alrighty, last question. This is just Dave Pan going back to him. He's commenting, Dr. Lee. Okay, so you're talking to Donghoon. Says 10.7 needs a little bit more reaming, but it will fit. Where he said that I should just wait for the 10. Because he says that if I do the 8.5, it's another option, but the surgeon says that I will be wheelchair bound for the duration of lengthening. So yeah, it's a hard decision. It's going to be a toss up. Do you have a lot of time to wait for the precise max? Because then you can do the 10. A lot of reaming. I think he's probably explained the risks of that, because then the cortical wall gets thinner and thinner. And I've heard surgeons that they don't over ream because then it becomes weaker and more risk for, fracture and stuff. So it's your choice, but
yeah. And can I need to ask Dave a question. How long ago was this conversation with Donghoon Lee? Because I'm not sure if you're aware, but Korea FDA actually recalled Precise 2.2 about, I think it was like 4 or 5 months ago, because Globus is switching to a new production facility. And from what I've heard, like it's going to take 2.5, maybe 3 years for the reapproval of Precise 2.2 by Korea FDA.
Whoa. From what date? What date is that?
From whenever it was taken off, which was 4 or 5 or 6 months ago, something like that.
Oh, 6 months, he said. Yeah, 6 months ago. Wow.
Yeah,
wow,
so
dude.
Yeah, you must have been talking to him before Korea FDA pulled Precise 2.2 off.
Oh, well, then your only options, like, does he have Fitbone, DJ Cyborg?
I'm not sure about.
Yeah.
I never heard of Fitbone there.
Fitbone is another
not in Korea, I mean.
Yeah. I don't know if they have it in Korea. I don't know. It'd be up to them. But anyway, guys, that was an awesome stream. We got some good stuff. We did some updates. Got to talk to my namesake. Haven't talked to him in a while. And yeah, I think that was great. All right, last we're not going to answer that question about surgeons. Is he the cheapest? We could find some surgeon in the middle of, like, I think there was a surgeon in Vietnam who like did this for like 10K, or Russia or something like that. And are they the safest and cheapest? I don't like to say the word cheap. I like to say affordable, right? Because it's all dependent on your budget. But I think that if you say cheapest, then it's a race to the bottom. It's like, what are their options for recovery? What's their experience level? Things like that. And you want to go with a surgeon who can keep you safe and help you get your goal. And then if you need to find affordability, then you find people in that tier of price structure, and you go from there. So
it's hard to recommend, right? Because if something goes wrong, then he will come back to internet and say, Victor, send me to that surgeon.
Exactly. I got that. I get that all the time. No, I don't. I'm just kidding. No, all my consultations, all the patients, all my namesakes do really well, right, DJ Cyborg?
Yeah, very well.
Cool. Awesome, guys. Appreciate you coming on the panel. Thank you guys in the chat for asking these amazing questions. We'll try to do something like this again next week. Yeah. So for episode 154 of the Limb Lengthening Live, SideQuest, we wish you luck. This is Victor from Cyborg for Life, signing out. See you guys next time. Peace.